Hello, good afternoon, everyone. Nikhil, will you say whether you can hear me?
I can hear you.
Thanks, Nikhil. Yeah. While we have 145 registrations, Dr. Malik is coming. I did, and Pritika also called. Uh, maybe, but just. Leaving for? Supposed to Bangalore. No, no, birding को होके आ गई.
Excuse the men who are here. They feel very bad.
Good afternoon, everyone. It gives me great pleasure to invite all of you for the first faculty development program that the Outreach and Extension Division of Dr. B.R. Ambedkar University, Delhi is organizing from today. We are deeply grateful that our Vice Chancellor, Professor Ansing Lather, is here today to inaugurate the faculty development program. Our registrar, Dr. Malik, will also join us very shortly. This faculty development program has been imagined to discuss and talk about not just the role of the pandemic as we experience it, but also the far-reaching impact of a pandemic like the one that we have experienced for future. That's the reason why the title of the FDP is Pandemic Experiences and Implications. The entire idea came from our Vice Chancellor wanting us as a social science and humanities university in Delhi to have a discussion around the kind of impact that the pandemic has created on our everyday lives, but is going to have far-reaching changes in all the kinds of professions that we are involved in. And she was extremely insistent and also asked us that it is important that we hear people who have worked day in and day out during the pandemic as essential workers, as frontline workers, as people who have been offering different kinds of services to citizens in this country. And that's the reason why the kind of resource persons that we have through this FDP is determined from that principle, from that logic. Today, we will be hearing the Vice Chancellor to give us the inaugural welcome address. And together with her, we will also be hearing Mamta Dahia, who is and has been a nurse for the last 12 to 14 years. Currently, she is working with Madan Mohan Malviya Hospital, and she's done her nursing training from Lakshmibai Batra College of Nursing. We were also supposed to have Mr. Karuna Sagar, IPS Tamil Nadu cadre, and currently the director of the Bureau of Police Research and Development in Delhi. However, just a few hours ago, we've come to know that he has an emergency meeting called by the Ministry of Home Affairs, and he's expressed his apology for not joining us for the inaugural. However, to make up, he has also promised that he will take one of the sessions in the faculty development program. So we definitely look forward to have him with the participants. As we all know that today we are doing the session both through Zoom as well as through the live YouTube, AUD YouTube channel. Till yesterday, when we closed the registration, we had 145 participants registering, and we are extremely delightful with the overwhelming response that we've had. And I would just like to, at this moment, end by thanking our Vice Chancellor for giving us this idea to do this course around the pandemic, to reach out to people from across the country and to discuss its implications and consequences. Thank you very much, ma'am, for being here, and over to you.
Thank you so much. Good afternoon, everyone. With a very exciting introduction by Rukmini, and that has been the case whenever she takes up any assignment. That is the 100% enthusiasm. Professor Geeta is here. Thank you so much you are here joining us. And Mamta, I hope you are going to share your first-hand experience, and people learn a lot from your input. We all know that COVID times were desperate times, unprecedented times, difficult times, but those were also good times. Looking at the positive side of what COVID gave us, probably we all discussions happened around the sufferings which we all had, but it also taught us a lot of lessons of life. So, in fact, COVID-19 infection and the patients who underwent the suffering and the losses in the family which happened, it was a death-defying war by even healthiest of the patients, because we were not sure about the outcome of the disease. We were not sure about what doctors and nurses are going to, how they are going to be handling the patients. We were not sure how the support system should actually react to the disease. We knew nothing about it. So it was a war against the death-defying kind of environment, very horrifying. The first wave, the second wave, And then we were expecting the third wave to happen, and thankfully God was very kind. The third wave did not take up, but we did feel some skirmishes of the disease here and there, and the society could give a common front. As I said, that it has given us a lot of lessons to learn, and those are life lessons and philosophical lessons and spiritual lessons for all of us. In fact, dealing with COVID was never my infection, it was our infection. It was never my problem, it was all of us' problem. So I was safe only when everyone else was also safe. So the humanity was in its best form, and they could be best put forward to fight out the horrifying symptoms of the disease, the community support system which came up. Confining ourselves to homes, sharing time with our family members wherever the infection was manageable, and families were lucky that they did not have to visit the hospital or the doctors, or and I was one of them where my family was very safe. So God was very, very kind to us. I had two elders, one 97 years old, my mother-in-law, and 84 years old, my mom. And my husband, already a senior citizen at home. We were keeping our fingers crossed all the time, because infection could walk into our home from any corner. And to protect the elders in the family, we had to learn and innovate very many ways to handle them for the daily chores, which included bathing them and giving them special attention in terms of immunity booster plans, etc. And thankfully for all the three ways so-called, they did not catch any kind of infection, and we were all safe, except that one of my maids, she had a high level of infection. We managed her by putting her into quarantine, and she stayed away. I just wanted to share here was that it was also the time of learning to cope up with all kind of pressures and stresses, and people were out and out there to share the best knowledge system they had at their disposal. So I'll be talking about that a little later. In fact, looking around, when all of you have also experienced that society actually became the crucible of all kind of experimentation which happened. And it happened because the pharma sector contributed in its own way. Nurses shared their first-hand experiences. Doctors shared their own set of, how diagnostically they were dealing with all variety of symptoms, variants of the disease. Nurses were doing their part of the job. The sector contributed in their best possible way they could do it. So the world became a crucible of sharing of information and knowledge, and it was at everybody's doorstep, right? We followed the WHO protocol, we followed all the protocols possible, and government did its best. I think every nation, every state, every governance system did their best in order to prevent the disease. And even the citizens of the country behaved very disciplined. Probably we're not that disciplined as a nation, but to COVID response, I think we all behaved very, very disciplined way. इतना अच्छा अनुशासन देश में शायद ही किसी भी ओकेजन पे मैंने देखा होगा जो कोविड के दौरान देखा गया था. So this also gives us insight into how we as a nation have also evolved, to the cause. Whenever there was a call from from our governance system, we all stood up to that. That was something very laudable and very appreciated. There was suffering all around. We were hearing a lot of stories about how our neighbors suffered, where almost all the family members were gone and the children were left behind. or all the family members. In fact, not only family members, even the extended family members were gone. I know of the families where extended family members were also gone from this world. However, the desperation and the suffering actually gave also an idea about redemption. How would we get rid of the whole problem? I don't know how strong we were all there to see all this happening and stood the test of the time. And we all shared the suffering with each other. I remember having talking to so many people uh, when we came to know that somebody was COVID positive and hospitalized. So we stayed connected. So from that desperation to redemption was also a kind of journey in which our society finally moved. So I would like to congratulate our systems where Indian system, I would say, where emotions play a very important role. Spirituality again plays yet another role. And as I said, the humanity was at its best while the COVID happened. So I'm taking the view as a commoner, not as what Mamta is going to be sharing with all of you. We also realized that the best, highest value was interdependence and not independence, right? And that was the best value which we learned. That interdependence is so important and such a valued value in the society, and we started appreciating that. And we started, in fact, with no differences of any kind, people showed that interconnectedness to each other. I could see that all differences in terms of your belief system, your religious practices, everything was gone. And we were all interconnected so emotionally and spiritually to each other. So one great lesson also has been that this testing time also gave us insight into our own inner self, where we evolved, and we evolved very, very positively. Also, one good thing which, as my observation, I think you can also discuss it further. There was no smearing in the society. There was no false propaganda about things, which generally happens. In any social phenomena, when the movement happens, there are all kind of interpretation, all kind of perception, negative propaganda happens. But that smearing did not happen in COVID times. Information might have been distorted, information might have been interpreted differently due to lack of information, probably that wasn't there. But a false propaganda against each other was what I felt was not there, did not exist during the COVID time. So that's what I say, that humanity was at its best when the COVID as an unprecedented disease happened here. A lot of lessons we learned. I hope the societies will continue believing each other, continue that interconnectedness with each other, continue to be emotionally bonded, continue to be spiritually rising above the situation and be very spiritual in their approach towards each other, and the positivity keeps flowing. All of you have joined today. Thank you very much for joining this program. We wanted to come out with your suggestions and also from the experts about beyond perceived experiences the nurses and doctors have. Beyond perceived experiences, when I say many of them have also, because I have doctor friends to share some of their experiences where they felt that some patients who were just collapsing, almost nearing their death, they revived and they could survive. Those experiences are also very interesting to share with each other, and also have an insight into as to how important the positivity and spiritualism plays its own role while beyond disease. When we look at the diseases beyond disease is also important. So thank you all of you for joining today, and I hope the deliberations of this FGP we are going to share with everybody here with the our stakeholders, everyone, students, teachers, administrative staff.
You're planning a publication as at the end of this, some kind of a manual where whatever has been discussed, we kind of divide it maybe into a few themes. What is the experience? What is the lessons learned? And what is the recommendation? Something like that as a manual, which we'll bring out after listening to all our resources.
That would be wonderful, and I would like to suggest that once we are out with that manual, I would like to present that manual to the state government so that they can use it at the school level for kids there. We can also do that.
And make a note of this, so another idea coming from you, which has to be implemented.
Thank you so much, Rukmini, for inviting me here. And since I'm to leave for the meeting, so
we'll have time for some tea. No. But
Meeting.
yeah, ma'am said
I
that.
have to be
But
there by 4 o'clock.
thank you very much for being here and welcoming and sharing with your thoughts, and maybe just one, a couple of sentences from what you just said: desperation to redemption, interdependence, and the role that emotion and spirituality has played in these times. These guide us in determining who and from what institutions the resource persons for this faculty development program is coming. So we have, as we said, from various institutions, we have nurses and doctors, we have people from the postal department, as well as delivery agents. We have people from the education sector, both in Delhi as well as two organizations who have been working with Adivasi children in Madhya Pradesh and to actually implement online education to school children there, the kind of challenges and possibilities that came from there. We would have them joining us. We would have people from the business world as to how small businesses and community enterprises may have been affected, but they would have jumped back. We would have community pediatricians talking about children, risk, disease, etc. We would have people from the mental health care sector, where providing psychosocial support to various people during this time. We would also have people from Gurdwara, and we are getting in touch with somebody from ISKCON to be here and talk about spiritual resilience during this time. So I think resilience and endurance kind of remains the thread through which we would be doing the FTP, the way in which we are planning the resource persons. So I just...
and this is spread over next 2 days?
No, this is actually spread over the next 2 months because we are only doing Fridays and Saturdays, okay. 5 p.m. to 7 p.m. So 4th of March, say we'll start, and it will continue till the 29th of April. That would be our last date. We would have, since this is a faculty development program, we'll also have attendance requirements, which we'll talk about at the end of today. And we'll also have assessment situations, because those are needed for certification. So 2 hours every 2 days a week for the next 8 weeks.
8 weeks. I may join in any time in between.
Please.
I can come and join.
Absolutely. We will share links with you.
Won't get certificate.
So I take away Geeta's certificate.
Geeta is not even saying that she's going to join. Geeta is not even
Now I
saying.
have to join because I have to give her my certificate.
No, you have to give the certificate or you have to complete the thing.
Could we stand up for a
We
group
can.
photo if
Yes,
that's
yes.
possible? We'll just take a minute from everybody who's online for a group photo.
Come here. आ जाओ किसी अरे आप मैम अरे प्लीज 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 मैं यहाँ हूँ किसी का
आप में से इतने लंबे
वो कहीं भी दिखता होगा किसी का दिख रही है
Thank you. Sanjay Lele. I should also say, ma'am, that every division in university that I have gone to vis-a-vis help for the FTP has been absolutely amazing. Kritika, of course, is one can't be thankful to her. But Registrar Sir, he's personally got in touch with resource person, talked to them, convinced that they should come and be part of the FTP. The IT division has been extremely helpful. The larger administration, of course.
Under the leadership of our honorable Vice Chancellor. And your extension and outreach initiative.
Everyone does his part of the
Yes.
job very well.
But they have taken an initiative, ma'am, very
Yeah.
fast. They have been continuously writing messages.
Congratulations to
carrying
both
out.
of you for taking up all the efforts. And Rukmini, of course, is the extra enthusiastic. Whenever I ask her for certain things, she will be on the job immediately.
Thank you.
Right, Gita? See you, you're attending on my behalf.
You have to certificate, give us.
I actually started from one hour, tradition to.
I'll be seeing maybe on third, I'll see. Second, I'm holding outside, so third, I'll see. Okay. Bye, Mamta.
Thank you so much for the appointment.
Bye. Continue to be here.
I now want to read on
I'll join some other.
Sure, sure. Thank you. So before I ask, Mamta to deliver her lecture, I just thought that vis-a-vis the participants who've joined the faculty development program, just to share with you the broader objective with which we thought that we are, we are organizing this. So mainly it is threefold, as some of you who would have read our sort of a concept note would know, that the first is to bring together various professionals sharing their experiences during the pandemic. Our entire idea has been that we will listen to people who have had first-hand experiences of working with the pandemic. And so either working or rearranging the way in which they knew that their professions played a role. So be it, teachers, be it theatre practitioners, be it community health workers, people have to also relearn a lot during this time. So what was that relearning all about? We'll talk about that. The second is to listen to expert voices and understand ways in which they had to improvise on their professions because of the lockdown. And finally, to discuss the short-term and long-term implications the pandemic has on human society. We all realize that there are ways in which life has changed. Even when we are getting back to something, we are also, that getting back probably will never be the same as it was before March 2020. So what are these changes that are going to happen, and what are these long and far-reaching changes? And any situation of crisis actually enables us to learn and move ahead. So what are these lessons learned and how do we move ahead is something that we would discuss. This is a faculty development program where we actually have participants who have registered across disciplines and across the country. And I am not overstating when I say that, because we actually have, of course, all the higher educational institutions from Delhi. We have faculty registering for this FTP, but we have faculty joining us from Haryana, from Tamil Nadu, from Chhattisgarh to Aurangabad, from Kolkata to Bihar, Gujarat, Punjab, and Arunachal Pradesh. So you would realize that it was not an overstatement that we actually have faculty and research scholars joining us from all across the country. We hope that, in some ways, the faith that you have in us, this faculty development program will be enriching, and each one of you will take something from here, which could be different. It may not be that everyone takes the same thing. It could be different, but you will be able to use it in whatever profession you are in future. I'll stop here and we'll ask our speaker today, Mamta Dahia, who I said is a nurse, and she's been working with Pandit Madan Mohan Malviya Hospital has a nursing training, and we are, extremely grateful to you that you found time on a week, on a day. I wouldn't be saying weekday, right? But on a working day to, spend time here with us and share your experience. Over to you, Mamta.
Hello everyone. Before I start sharing my thoughts or my experience with you, I would just like to thank everyone for organizing such a session where I can and others can also share and express their feelings, their thoughts. Basically, if I start, I would say I think it was sort of a roller coaster for everyone, for the frontline workers also, for the people who are living inside the houses, and for the everyone. It was a kind of a feeling for everyone, like we have been captured in a kind of a jail where there is a no escape, but there is a God, we can say now. So as a nurse, I have seen people, observe people very closely during those times, because I have seen people suffering from mental, physical stress and how they came up later on. Initially, actually, when we saw that people are suffering, people were struggling, people were dying in lack of medical facilities during those days. So there was a point when the other staff also, medical staff and other people also, we also went under some depression. Okay, how we will manage, how we will save. But at the time, I think that was the time when we and my other colleagues also, we decided to help people, to save people as much as we can, as possible as we can. And at that time also, most of the medical staff get affected due to that virus also, and there's an extreme shortage of staff. So we decided to extend our duty hours. We did duties from 6 to 12 hours, 8 to 12 hours, wearing all that PPE kit and all. And we used to eat and drink before wearing that PPE. So basically 12 to 14 hours also we remained without having anything. So that was a hard time, I must say. And even though, the thing become worse when the government, in spite of like having all the measures, government had put all the measures, but though the cases were increasing, mortality rate was increasing, people were dying. So the government took another major step, that he imposed the, state border sealing. So that time also, most of the people are coming from the other states also to work in the Delhi, or from Delhi to other states. So the commute become very difficult. Even in spite of showing our ID cards, police were not allowing us to cross the borders. And there we have to decide whether either we do our duty or we stay at home. But as usual, we are Indians. I think we prefer duty first, na? So we are supposed to remain in Delhi, but I'm sorry to say, यहाँ पे थोड़ा सा मेरे को बुरा लगा, क्योंकि वो जो situation थी वहाँ पे, we are supposed to stay in a Delhi, we have to find some shelter, but that was a time when most of the citizens, I will not totally blame the people, but they refused to give us stay at their homes, even though who were already residing at the as a tenant, they are supposed to ask to vacate the houses. So I think if we are there for you, you should be there for us. That is the thing we should learn now and for future also. That together we can, and together I think we did. So even though living in a house, in own house, was very difficult for us. We were living in a separate room, away from the family. I had a son who is 10 years old. For him, he thought, I don't know, Mama, why are you not coming with me? Why are you not sleeping with us? So I can see the pain and the urge to hug me. But what all I can say to him is just, it's okay, beta, there's nothing. Just a small infection and it will be gone. But every day, how much it will take, and कितना time इसको लगेगा वो भी हमें भी नहीं पता था उस चीज को. But somewhere जो medical team थी, they managed to help people. और जो I think जो fault अगर हम कहेंगे तो वो सबसे basic जो था, it was from media people. Small things. There was a shortage of supply, but not that much. That they created the panic in the people after showing repeatedly things. There is a shortage of supply, oxygen. So after listening such thing, people scared. They started treating themselves at homes. They जिनको PCM की जरूरत भी नहीं थी, they started taking remdesivir injection, which causes black marketing. People they buy oxygen cylinders in 80,000, 90,000 and keep that at their homes for measures, precautionary measures. But actually, I don't think everyone needed that. So if in case, I just request people कि in case future में भी कभी ऐसे कोई disease आती है तो please, government is there for us. Like this time also, government did a best part. So listen to the people, listen to the medical people, what they are showing. फैक्ट्स को देखिए, पता कीजिए, उसके बाद ही आप आगे बढ़िए, क्योंकि इस तरीके से तो चीजें मैनेज हुई हैं, बट वो जो हुआ है वो उतना नहीं होना चाहिए था. हर किसी ने सफर किया, मेंटली भी सफर किया, फिजिकली भी सफर किया, लेकिन लोगों का भी सपोर्ट चाहिए. उनको समझना चाहिए कि किस लेवल पे किस चीज की जरूरत है. लास्टली बस यही कहना चाहूंगी कि आई थिंक सबका सपोर्ट जरूरी होता है, और आप लोगों की तरफ से अभी ऐसा नहीं है कि पीपल ने हेल्प नहीं करी है. मैंने देखा है कि ह्यूमैनिटी भी सामने आई थी. लोग अपने घर से निकलकर दूसरे लोगों की हेल्प कर रहे हैं. इन केस ऑफ मेडिसिन दे आर प्रोवाइडिंग फूड एंड ऑल थिंग्स आल्सो. इट्स ओके अप टू अ सर्टेन पॉइंट ऑफ अ थिंग, जहाँ पे आपको लगता है कि ये चीजें पॉसिबल है, आप वहां तक करो, लेकिन उसकी वजह से आप डिजीज भी स्प्रेड कर रहे हो, वो चीज नहीं होनी चाहिए. बाकी तो थैंक्स, आई थिंक दैट्स इट.
आप थोड़ा बोलेंगे कि उस टाइम में सोचिए कि फर्स्ट वेव में या सेकंड वेव जिसमें भी बोलना चाहेंगे, एक दिन कैसा होता था? एक दिन normally what was it like?
Okay, if I talk about first wave, so first wave में it was just a panic. The infection was not that much severe. Second wave में एक दिन is not एक दिन, it was just like a year, 1 year you can say, because the day started when we get up away from the family, we cook for us and we left our home, and when we left from the home हमें नहीं पता होता था कि शाम को हम लोग घर कैसे पहुंचेंगे. इन्फेक्शन लेके पहुंचेंगे, खुद जाएंगे, वो ठीक है, लेकिन फैमिली वाले को लेके जाएंगे, वो नहीं होना चाहिए था. So when we start our duties at home, we eat, we drink before wearing that PPE. Then we go to the patient. हाँ, सभी पॉजिटिव हो गए थे हम लोग. We went to the patient, we served them, console कर देते उनको. Somewhere back of the mind हमें भी पता होता था कि यार, I don't know कि he is going to survive or not, but we have to give positivity to them. और उसके बाद फिर 6 आवर्स की ड्यूटी है. कभी होता था कि हमारे खुद के जो स्टाफ होते थे वो भी फेंट होके गिर जाते थे, क्योंकि 12 आवर्स इज सच अ लॉन्ग आवर्स, वी आर नॉट हैविंग इवन अ सिंगल सिप ऑफ वाटर. तो उसके बाद फिर आप 12 घंटे उनको पेशेंट को सर्व कर रहे हो, वहां से फिर ड्यूटी से आ रहे हो. ड्यूटी पे आने से पहले यू हैव टू सैनिटाइज ऑल द थिंग्स, योर क्लोथ्स, योर इवन योर पेन, योर ईच एंड एवरीथिंग you have to sanitize. Then we left for home. There also we are living away from the family. और वहाँ जाके भी again we have to took all the measures, all the precautionary measures. Again we are living in a separate room. There was a time when we have been posted in some another hospital in a COVID ward also. There we have to serve for 15 to 20 days continuity. Like 15 days we got job and 15 days we have to remain in a isolation. So for that 1 month becomes very difficult for us, because we are not able to see our family again. Family is the strength for everyone. We can face everything if our family is with us, but we are not able to see them. We are just having a video calls, we are having just phone talks. So that was a very difficult time for everyone.
So in the first wave, we did not know much about COVID.
Yes,
right?
ma'am.
So and of course there was information all across the world that you got on treatments and what to do. Everyone was trying different things. Vaccines had not yet been developed.
Yes, ma'am.
So between the first wave, the kind of treatment protocols you had, and what happened, because by second wave there was more experience.
Yes, ma'am.
More knowledge was there. The idea that there would be so many different variants and how to tackle. So was there a big difference between the treatment protocols you had during the first wave when we didn't have much knowledge to what happened when the second wave came. And of course, vaccination developed in a big way post the second wave, during and post the second wave. So how do you see things now? Omicron was anyway a little milder in terms of its impact, at least in mortality, kind of way. But so can you speak
Actually,
about that?
I think during first wave, we were just observing and seeing that COVID had started from another countries. It was not even a country. Very later it came to our country.
Yeah.
So by the time the government took measures, people started remaining at home. I think they during March 21st or 22 lockdown has been announced by the government. And the people started remaining inside the houses because they were seeing on the TV that on the television they were seeing that in China so many people are dying, in there so many people are dying. So people had a fear at that time of COVID. By this and as people were living inside the houses, so there was a very less spread of disease, and that infection was not that much severe as compared to the second one. And this was the thing that prevent the people from getting infection. And by the time second waves came, people become very liberal, very they thought कि like first wave we will manage in second wave also. So you must have been remembered that जो second wave था वो बहुत एकदम से बहुत lethal हो गया था, एकदम से mortality rate raise हुए थे. क्यों? Because जो लोग थे उन्होंने उस चीज को उतना सीरियसली नहीं लिया. वो फर्स्ट वेव में इतना सब कुछ इम्पोज हो गया था, इतना सब कुछ हो गया था कि उनको लगा कि लाइक इन सेकंड वेव हम लोग कोप अप कर लेंगे. लेकिन सेकंड जो था वेरिएंट था मैम, इट वाज lethal, it was severe than the first or than the third one. तो उसमें क्या हुआ कि आपने एक और चीज आपने मे बी यू हैव नोटिस्ड दैट ड्यूरिंग फर्स्ट वेव मोस्टली एल्डरली पेशेंट हैव गॉन एंड ड्यूरिंग सेकंड वेव यंग पीपल, यंगर ones. For that, this is my own theory or my experience, I can say that for that could be the reason that during second wave, we are the healthy, youngers are the healthiest one. They can manage their oxygen level up to 90, up to 85, they can manage. And if we are sitting at a home, we are just relaxing, we don't have any work to do. So if I get infection also, so by the time my saturation level is at 85, 86, 87, 90 or 84, I'm fine. Lekin slowly jo infection rate increase hota gaya, I don't know what is happening inside my body, but that thing is getting worse and worse, and the time came, the level becomes to 70, people get, younger ones started getting affected. They had starting respiration problem, the saturation level falls, they had fever. तो वो जो 70 saturation पे they went to the hospital और 70 पे किसी को manage करना it's very difficult. तो I think that could be the reason कि जो young people जो second wave में गए हैं वो इस वजह से गए, due to negligence भी नहीं कहेंगे क्योंकि everybody is not having, हाँ, और third wave तो it's not that much severe. Or second thing is people started during second wave also, people started taking tab prednisolone themselves. It has a steroid actually, it has a bad effect on health, but people
discouraging हुई ना.
This is the plan. Yes.
Actually, you have to take it at the right time when the doctor tells you.
Actually, if your it was a instruction or the thing that if your saturation level is falling, if you think that your saturation level is falling, you are having difficulty in breathing, then you are supposed to take that tablet by the prescription of the doctor, because the dose is also mandatory. Like for children different, for adult it's different, and for elderly it's different. But people started taking prednisolone. There came a time when जो normal cosmetic shop होती है जो कि prednisolone, I think hardly it costs 2 rupees or 3. That also they were selling in the 40, 150, 200 rupees. And there is a lack of that medicine, injections also. तो वो सब के लोगों की वजह से हुआ कि उन्होंने चीजों को समझा नहीं और जस्ट उनको लगा कि ये चीज मे बी वो गलत नहीं है, क्योंकि अगर मुझे भी लगेगा कि दिस थिंग कैन सेव मी तो आई विल डेफिनेटली होल्ड इट.
एक और चीज बताइए आप, क्योंकि it was such a pressurizing time for all of you who are working. how did you cope? अगर आपको मैंने of course you know that it looks an abstract thing, but then I'm sure there were certain things maybe that you did consciously to actually cope with the situation. And I'm also trying to think कि nurse के बीच was there any thanks Vika. Was there any association or any kind of community discussion ki nurses are going through these, let us all come together and let us see how to address it. तो यही दो, एक तो इंडिविजुअल लेवल पे कोपिंग होता है और दूसरा प्रोफेशनल लेवल पे. Was there any group that that got formed or was there previously,
or at least you could use to vent
or you use that space to talk about it in some way?
Like as you said that there is an individual cope up, that is a different thing. But other than that also, yes, we had our association. Every hospital has their own group of nurses where we used to discuss the thing. We used to on daily basis we used to usually discuss the things how we will provide our best to the people. Like if we save them, we will save ourselves. Indirectly, we are saving ourselves also. So उस टाइम पे थोड़ा सा ये हुआ था कि स्टाफ की भी शॉर्टेज थी. डर हुआ हमें भी कि why should I, है ना, और शॉर्टेज ऑफ किट्स हो गई थी. टचवुड इन दिल्ली आई थिंक ऐसा सीन नहीं हुआ, बट इन अदर स्टेट्स हुआ. वहां पे भी इफ people of our profession were suffering a lot due to this thing. तो हमें भी there was a time when we thought कि why should we, it's a job only, why shouldn't we leave and stay back at home? But no, then we thought कि अगर ऐसा सभी सोचने लगे तो who will do that? And if frankly speaking, मुझे कभी एक टाइम पे ऐसा लगा था कि मैंने प्रोफेशन गलत चूज किया. लेकिन इस ड्यूरिंग कोविड जब when I save my family, because obviously public serving people is my job, but I save my family also on my basis. I daily monitor them in spite of making a proper distance. That time I realized that no, it's the best, it's a noble, and it's a high profession, and I must respect this medical profession. Later on, if I say कि क्या चीज बूस्ट अप किया, तो मैम बूस्ट अप तो आई थिंक कुछ नहीं. आई थिंक
इंटरनली ही आता
है कि yes, it's my job, ultimately it's my job, I have to save people. क्योंकि अगर मैं नहीं करूंगी कल को that would be my father on that bed also. ये चीज माइंड में थी कि मेरे पापा अगर हो और अगर कोई दूसरा मना कर दे तो how will I feel? तो सिमिलरली हमें करना है बिकॉज ये हमारी जॉब है, और हम अगर सेव करेंगे तो कहीं ना कहीं जाके तो ये डिजीज खत्म होगी. पीपल डाइड ऑल्सो, मतलब लाइक हमारे प्रोफेशन में से भी बहुत सारे लोगों की डेथ हुई थी. किसी के फादर, किसी के मदर, बच्चे छोटे रह गए, लेकिन still they, if they are doing, then why can't we? तो ऐसा कुछ नहीं है मैम कि वो कुछ अलग से ऑर्गेनाइजेशन हो. आई थिंक जो नर्सिंग प्रोफेशन है ना, जब हम वेरी फर्स्ट हम लोग ओथ लेते हैं तो वो होते हैं कि वी विल सर्व पीपल डिस्पाइट ऑफ एनीथिंग. तो आई थिंक वो काम इसीलिए लेते हैं, तो वो ही एक बूस्टर होती है, एज सच कुछ नहीं.
तो क्या आप ये बोलेंगे, मे बी दिस वुड बी द लास्ट थिंग दैट आई आस्क, क्या आपका 12-14 साल का एक्सपीरियंस इस प्रोफेशन के साथ है, इससे पहले कभी इतना डिफिकल्ट सिचुएशन आया है प्रोफेशनली, या वाज दिस द फर्स्ट रियली डिफिकल्ट सिचुएशन, या पीछे जाएंगे तो और भी कुछ रहेगा? पीछे जाएंगे तो आई थिंक हम लोग जब छोटे थे तो देयर वाज अ प्लेग काइंड ऑफ डिजीज, वो भी ऐसा ही था जो कि इस तरीके से हुआ था, लेकिन एज सच कुछ ऐसा नहीं हुआ था जैसा अभी हुआ है. अगर मैं अपनी बात करूं तो मैंने प्रैक्टिकली मैं होल लाइफ एक्सपीरियंस यही देखा है जो कि इस तरीके से था, इतना फेटल था. उससे पहले भी अगर आप बैक ऑफ हिस्ट्री जाएंगे तो उस टाइम पे था हाँ वो तो बहुत साल पहले, so that is a different thing. मैं आप ही के
नहीं मैम, मेरे टाइम में नहीं है. From the last 12 or 13 years I am serving this profession, but उस टाइम पे ऐसा कुछ नहीं था. लेकिन इसमें जो मेजर थिंग था वो यही था कि दिस डिजीज इज डायरेक्टली रिलेटेड टू द रेस्पिरेटरी प्रॉब्लम, मे बी और इट इज इन्फेक्टिंग थ्रू द रेस्पिरेशन, थ्रू द ड्रॉपलेट थिंग्स. So this causes the severity of disease. और
2010 में स्वाइन फ्लू आया तभी थोड़ा सा लगा था,
लेकिन स्वाइन फ्लू भी ना मैम, डेंगू इज समवेयर यू कैन मैनेज, मतलब इट्स नॉट लाइक स्प्रेडिंग disease dengue. This is due to mosquito it is spreading na? And the yes, swine flu and this is through the respiratory. तो वो दो चीजें, वो डिफरेंस है कि डेंगू में somewhere you can take measures so you can prevent. Here you have to control yourself first, then others. So first if I take precaution, I will use mask, I will use sanitization, I will make sure that I won't spread infection to you, then I can stop and I can save myself. तो वो ही चीज यहाँ पे I think है कि आगे भी यही होना चाहिए कि next time अगर ऐसा कुछ है तो परेशान ना हो, और सब कुछ अपने आप से करने से बेहतर है कि एक बार गाइडलाइंस को पढ़े, गवर्नमेंट के मेजर्स को सुने, क्योंकि अभी भी हुआ है कि हमारी गवर्नमेंट ने ही डिड अ बेस्ट पार्ट
कम्युनिकेशन.
हाँ, बाकी कंट्रीज के हिसाब से भी हैड अ वेरी less amount of mortality rate.
Is there space for asking? Yeah, I think among the participants who would like to say something on hearing Mamta, maybe about their own experience of probably encountering hospital nurses during somebody has raised her hand.
Can I speak?
Please.
First of all, I would say it is really a very good initiative and an excellent topic. Basically, I'm a nurse. My BSc and MSc is nursing, but my PhD is in public health. I'm working in IGNOU. And I had a field experience and teaching experience. What you were asking about the group support to nurses during COVID, I would like to highlight all our associations, College of Nursing, groups of various activist nurses have come forward to give support to nurses. That was the beauty of this professional commitment for the nurses. And our Trained Nurses Association of India has done an excellent work to provide support to all the nurses. And second thing, you have last question, what you have asked, what nurses have faced before this. This was a pandemic. Actually, after every 100 years, we have one pandemic. And it has its own natural history of disease. In every time, if you see during pandemics over years, the second phase of disease is very fatal. And I think she is very young to tell you, I think in 88 and 89, there were floods in the Nan Nagri area. That was a challenging time for all the doctors and nurses when we have taken care of the resettlement people in the slums. And it was a challenge for doctors and nurses to go and give care there, the way the people were suffering there. I would say that was an epidemic, cholera epidemic was there, but this was a pandemic. That's why it has a more fatal consequences. Only the concern is the way people have behaved with doctors and nurses. There was a violence in all parts of India. I think sometimes our media interpretations are not as per we should say the scientifically they give. In India, I'm very sorry to say, the way they project the disease, its negative parts they project more rather than the positive aspects. I think media has to play a very important role. So that is just my concern. I was listening all the comments what this young girl has given. I think there was a challenge of training, the way doctors and nurses have suffered. I think there is a scope to do one very good study you can do. because very few people have done actually the study the way they have done. What were the consequences of wearing PPE for hours and hours? What were the psychosocial aspects they have suffered? And there are some doctors and nurses who have not gone to their home for 1 or 2 months, the way their families have suffered. I think that is a other part of the story. If we leave aside what the way the people have suffered, that is a different thing. Thank you so much.
Thank you, Dr. Sood. That was so, both informative as well as inspiring at the same point of time. To hear from you.
Thank you.
As senior. We have Parushika. Please go ahead and speak.
Yeah, hello.
We can hear you. Please go ahead.
Okay, thank you. All right. So I'm from Aligarh Muslim University, and Neerja ma'am, hello. I was in IGNU for some time. I recently joined back AMU. Neerja ma'am is there if she can hear me. All right. So yeah, there are two.
Nice.
Yes, ma'am. Yeah, so there are 2 points that I also want to know from the speaker, as well as add a few points to her statements about the shortage of nurses, because we were listening to some nurses in Aligarh and in other districts of UP who were complaining that there were vacancies which were not filled, and at the time of pandemic and such situations which are unforeseen and unprecedented for that matter, if we have such shortages on a regular basis, we'll never be prepared for any calamity of this sort and of this scale. So about the shortage of nurses and what were the nurses, because we were also seeing that many nurses and doctors were going on strike, and some were also resigning because of the disproportionate income that they were getting from private hospitals. So the role of the state hospitals and the role of the state institutions and the government in having the system fixed, not just in the time of pandemic or crisis, but overall health system. So that's what I want to know from Ms. Dahiya about the shortage of nurses. What were they thinking and what were her colleagues thinking about it? Because there were many nurses who were protesting, and some of them had resigned because of disproportionate income. They said that the risk was too high in comparison to the salaries that they were getting from private hospitals. So it's better to leave the job than take the disease and affect everybody at home. So these 2 points about the shortage of nurses, disproportionate income in private hospitals, this is what I want to know from her.
Thank you very much, Parushika. So maybe shortage of nurses पे आप थोड़ा सा बात कर सकते हैं.
Thank you, ma'am. Yes, ma'am, it is right. There is a shortage of nurses, and the only reason is that lack of the, like, if we saw in today's today's world, there are n number of professions, but I don't know why only the nursing profession is people keep it mind like this is just a low grade profession. They don't keep it. Actually it is. People think कि nursing ही तो है, injection ही तो लगाने हैं. So this is the thinking of the Indian people. I'm just saying it is the thinking of only people of India. If you go abroad, you will see there is a lot of appreciation, respect for the nurses. But only India, यहाँ पे firstly जो thing disconnect हुआ
नहीं ठीक है नहीं disconnect नहीं.
Tanushri, if you permit me, I would like to say shortage of nurses is because in none of the hospital, irrespective it is government or private, the recommended norms are not being followed for filling up the post. Then
yes,
there is okay. That is the basic reason in India, and that norms are also 50 years old. No one has revised. Recently, there was a committee, which I was also a part of it, where we have recommended the revised ones, but you also know the way the government works, when it will be finalized and when it will come out, we don't know. Second reason for shortage of nurses is because there is so much of vacancies in the abroad that our nurses are going out from the private sector.
Right.
And the government sector from the beginning, if you see the history, 30 to 40% vacancies are there. That is a trend in the government. Then you have asked the disproportion of the private sector, the payment sector. Already there is a judgment of the High Court, which is not being implemented by any of the states. Delhi, I think, took a decision to implement it, but again, I think Indian Medical Association has gone to the court against that decision. I don't know what is the fate now, but very few hospitals are giving a good pay. That's why you see post COVID, there are vacancies in all the countries, and our nurses are leaving the country. That
Right.
is the basic reason. Two reasons I would like to say.
Thank you very much.
Thank you so
Right.
much
for those information. And I also would want to say that in the course of the FDP, we'll actually have 2 more doctors coming and talking to us. We'll have somebody from Holy Family Hospital, and we'll also have someone who's been part of the public health movement in this country and works as a community pediatrician, who is at the moment also teaching in the Masters of Public Health program that Ambedkar University Delhi launched from this year, and in fact has been one of our very real responses to the pandemic. So I would hope that some of the questions that Tarushika you have, and some of the information that you are as such a senior person, Dr. Sood, you are sharing with us. I'm sure with, today is the beginning, and as we go ahead and as we also hear other doctors coming in and talking to us, we'll be able to address some of these questions as well. And, we will also, in some ways, we'll also learn from each other. This is, after all, a faculty development program. All of you are in the profession for a few to many years. So we'll also learn from you as we go ahead in this, FDP. Maybe what I'll do finally is just talk about a couple of few initiatives that from Ambedkar University Delhi we actually took as a response to the pandemic. And I think what I will do is I would want to start with the library. Not because the Deputy Librarian, Dr. Alka Rai, is here with us, but actually to make a claim that that I'm sure all libraries had to undergo a relearning as to how is it that they could offer their services to their readers. The AUD library has always been key in that sense. It has always been that. But at the same point of time, I would like to emphasize that during the pandemic, what we did was that there were video tutorials that was done when lockdown started in March 2020, and the library through these video tutorials shared it with the students, showed them how to install some of our own software in Fed or Sophos to remote access the resources that library has. So what otherwise would happen is that students would be here in campus and they want to know something and they would go to the library personnel and ask ki ma'am ke dikha dijiye, sir ye dikha dijiye. Lekin during the lockdown that couldn't happen, right? So those video tutorials, which actually Dr. Rai herself made, shared with all students, and the students benefited tremendously from it. In fact, I think that even us faculty benefited tremendously from it, not just students. Other than that, I think a couple of other initiatives that was taken was, based on, some reasonable demands made by library users, scanned chapters, keeping copyright in place, was actually shared with faculty so that faculty could share it with students. Again, it was like a kind of a way in which you would go to one section in the library, which is the textbook section, or aap wahan se utha lenge, and that would help. Since that was not possible, the library came in this way. Besides, also, on request of visually challenged users, The library also converted print books to audio books and shared with students. So the library in AUD has kind of tried to help in multiple ways and literally reached homes of all our users during the pandemic. And we kind of, towards the end, when we started to again reconvene into campus, we actually also subscribed to and started our e-library, which is RefRead, which is this single engine, single portal through which you can actually access all the resources, e-resources in the library. So the library did play a very important role, besides which the psychological support that our Essa clinic, which has been there at AUD from the very beginning, has also provided. It's called the Essa Psychotherapy and Counselling Clinic, and it offers psychological support to students during the pandemic to help cope with disruption of lives, to help cope with grief. I think even Mamta was talking about grief and loss and suffering, and our Vice Chancellor was also talking about that. So some members of the clinic were actually available over phone and email, literally round the clock, helping our students. So that was another very, very important facility that AUD gave. Finally, we actually had vaccination centers here in our campus. In our Karampura campus, the vaccination center was there. Even our Lodi Road campus had a vaccination center. Briefly, we had a vaccination center even here at the Kashmiri Gate campus. So that was, and this vaccination center was open not just for AUD faculty, but also for family, friends, domestic workers in our households were also, extended vaccination through these centers. And there was a larger medical, reaching out to the medical community and setting up a medical team, both in terms of, physical medicine, general practitioners, physiotherapists. All of this was arranged. And finally, we actually had 3 to 4 months long online yoga sessions through the pandemic. Actually, yeah, and some of us participated in it quite seriously. But actually to understand and understand the importance of certain kinds of exercises, especially breathing exercises, which goes back to what Mamta says about this infection, the close connection between this infection and the respiratory system, and the need to strengthen our parts of the organs for that. So these were some of the initiatives that was taken by this university during the pandemic, and we do hope that these are initiatives which are not temporary. These are actually initiatives which we would need for the future as well. So on that note, I would kind of call this to a closure today. Again, thanking everybody for registering yourself for the FDP. We would, as was written, this participants would be required to attend 80% of all the sessions. Today, we are not doing any attendance, but from the 4th of March, we will be doing, an attendance record. And how do we do it will be shared with you through email and through the WhatsApp group that has been made. I would request all participants to join the WhatsApp group so that you get to, so that you have the information right there. What we'll do, so for the 4th of March, our resource person would be Mr. A.K. Poddar. He is ADG in the Postal Department of the Government of India. So that day we will listen to him, but we will also have an exercise of knowing who all our participants are. So it would be a combination of knowing each other, a little more, just in terms of names, where you are from, maybe what prompted you to join this FDP as well. And we'll also listen to Mr. Poddar, who has very graciously given time. So that would be the 4th of March. And the 5th of March, which is the day after, we'll have Miss Ranjana Dave, who is a dance practitioner and has been with the Gati Dance Center in Delhi for long. She's also been our faculty in the dance practice program that AUD did for 2 years, NA dance practice, through the School of Culture and Creative Expressions. So we have Ms. Ranjana Dave sharing with us, again, her experiences around body movement, performance, and what kind of pedagogical changes did she have to do during the pandemic. So we have these 2 speakers confirmed and lined up for 4th and 5th. We also hope that by the next weekend, we will be able to share, next weekend or so, we'll be able to share with you the entire list of dates, and the dates are fixed, the entire list of resource persons with you. We will be able to do that by this weekend. The final thing is that there is an assessment requirement for the FDP. So the attendance requirement is 80% and the assessment requirement is 60%. We have 2 forms of assessment. One is an MCQ kind of an assessment, which from some of these sessions, there would be some MCQ questions that would be given to you for you to answer. And we also want a final presentation, which is a more reflexive presentation where you try and connect your own profession, what you are doing, or what is your research interest with what is it that this faculty development program offered to you. We'll talk about it more. We'll share, some kind of a format or something, and we'll discuss it in the later sessions. But these are the 2 things that we thought: an MCQ, which is more instrumental maybe, but yet important, and another reflexive kind of an exercise. Thank you very much. If there are questions, if there are queries, please feel free to write to either Dr. Kritika Mathur or me, Rukmini Sen, and we look forward to your participation in all the sessions. And, yeah, I think I'll stop.
Yeah, we'll meet them on the 4th.
We'll meet all of you on the 4th.
Thank you.
Thank you.
Thank you.
Thank you.
Oh, we should thank
So much.
Thank you so much. Yeah, exactly. He stopped the recording. So off the recording then, thank you very much, Mamta. Thank you for being here and
Thanks
sharing.
to you. I think this is the first thing from I have been sharing. अच्छा लगा.
ये